So one of the projects that we're working on in collaboration with the nurses is to teach them how to measure bladder volumes. Some of the indications for this include pre-catheterization in little neonates, where you're not sure whether or not they've peed and you want to get a urine sample. And then also to look at the bladder prior to ultrasound, comprehensive ultrasounds for things like the ovaries. And so what we're doing is when we're teaching the bladder volume, we're looking at two planes of the bladder, just like in your regular fast view, both in transverse and longitudinal. And the measurements that we're taking is, of course, the depth, the width, and then in the other plane is the length as well. The controversy with bladder volume is that the bladders come in all different shapes and sizes. They can be square, they can be round, they can be oval. And so it's just a really rough estimate. And so if you actually speak to the urologist at our center, what they do on average is once you've gotten the volume, where you're multiplying the length, the width, and the depth, is to divide by half. And that should be kind of the minimal volume of urine that you're going to get when you catheterize. And the reason they use half is because that's kind of the lowest denominator that you're going to find. And so if you cath, you're always going to get that minimum number. And I think that's important when especially when you're catheterizing newborns. And the cutoff that we use is approximately 2 centimeters cubed, and that should be equivalent to about 2 mLs. And that should be enough to do your urinalysis and send for a urine culture.